Good afternoon. Welcome to the briefing at the county EMA. I think it's our day 32. These days keep running into one another. Joined here with Chairman Kern again this afternoon, and of course Sam Bierman from the Health Department. Sam, more numbers to report today.
We do have more numbers to report today. As we have done in the past, our numbers for St. Clair County are St. Clair County residents that have been tested. And as of today, we are at 954 that have been tested. 201 that are positive, which is an increase of 8 from yesterday. And that includes a female in her 20s. I'm sorry, 2 females in their 20s, 1 female in their 50s, 1 male in their 50s, 2 males in their 60s, 1 male in their 70s, and 1 male in their 80s. And we are at 678 negative test results, with 75 results still pending. And we do have some sad news to report today. We have an additional death that we will be reporting, so that takes our total up to 11. And the new death is a female in her 80s who did have underlying health conditions. And our thoughts and prayers go out to that family as well as to the medical providers who have cared for that patient. For state totals, we are at 110,616 that have been tested. 23,247 that are positive, which is an increase of 1,222. And we are at 868 deaths, which is an increase of 74 for the state. And as, again, all of our thoughts and prayers go out to those families as well. I would like to report that St. Clair County Health Department did receive another shipment of personal protective equipment yesterday, and that will be going out to our long-term care facilities that have contacted us for more of that equipment tomorrow. So we're excited to get more of that out into the hands of those that need it.
Great, that's great news.
Now I will turn it over to Chairman Kern.
So Sam, let's talk about numbers for a little bit, because I'm going to be reading the zip code reports, and
Yes.
The numbers are a little different than the Illinois Department of Public Health numbers.
They are.
Let's talk about the process that you use to gather numbers again.
So daily, around 11:30, 12 o'clock, we start calling the facilities that we get our numbers from. And the numbers that we report daily, we get numbers from Memorial Hospital, and that includes the ones that they have tested in-house as well as through their drive-through. Eastside Health Department's numbers, our numbers, and then we combine those. And then we also get from the Med Express in Collinsville, which is one of the local testing sites.
And the Missouri hospitals are supposed to be keeping in touch with us.
They are. It's sporadic when we get faxes, but it's hit and miss. And so we do get, seems like they come in dumps. We won't have one for a couple days and then we'll get a bigger one. So it just kind of depends. But when we report our numbers, it's what we have reported to us up to the minute of when we're starting these briefings.
So we've got a pretty accurate total.
We do. I am very confident in the numbers that we report, that they are very accurate for St. Clair County.
Great. Thank you, Sam. I appreciate
Absolutely.
that explanation. So let's remember to be kind to each other. We're many days into this now, and as we get cooped up, as stress levels build, it's a time we just have to kind of remember to take a deep breath, literally, and remember to be kind to each other. Remember to check on your friends, your neighbors, your relatives. A little telephone call or a text goes a long way. I think during these times, a phone call is better because you can find out a little more detail how a person's doing, maybe dig into whether if someone is elderly or immune compromised, whether you could go to the grocery store for them, run an errand for them. Even mailing a letter these days is some people take their lives in their hands by going out in the public. So as these stress levels grow, you also have to remember your mental health. And Illinois has a mental health hotline, and the telephone number is 1-800-889-3931. And if you're experiencing any kinds of issues or you have any questions, be sure to avail yourself of that service, 1-800-889-3931. So, on the front line, our police are out there every day. They're going into houses. They're putting their lives on the line. They have families also that they come home to at night, and beyond all the usual dangers that police departments experience, now they've got COVID-19 on top of that. To discuss with us today is Steve Johnson. Steve is the Chief of Police for the Swansea Police Department. Steve, welcome.
Oh, thank you, Chairman. I appreciate that.
We
And
appreciate you being here today. Steve, talk to us a little bit about how COVID-19 response is affecting the way you do your job. You've been in law enforcement for many years, so.
I appreciate that. I'll tell you, it's changed quite a bit. You think about a police officer that every day when they get ready to go for work, they put on their uniform, they put on a ballistic panel, they put on their firearm, a taser. We have to carry a tourniquet on us at all times now. We have to have all this additional equipment, Narcan, all this stuff. And then you add to it on top of that we have to wear goggles, gloves, and N95 masks anytime we believe we're going to be within 6 feet of someone. And it's changed a lot of our tactics and the things that we do. I will tell you this, though, for years and years and years, probably ever since my dad was a cop, law enforcement has been the master at social distancing. We know that time, distance, and cover saves our lives and helps de-escalate things. So we're good at staying away from someone until we absolutely have to be close. Unfortunately, in the times that we're in, the good people understand this social distancing and sheltering in place, and they do those types of things, except for the essential people who have to go in. But some of the bad guys that are out there, they're not understanding this. We're still having burglaries. We still have things where we have to go hands-on and arrest people who don't want to go as easy as they should. So keeping the law enforcement officers, our EMS providers, and our firefighters safe is absolutely critical. So we've changed a lot of our procedures of how we do it. Unfortunately, sometimes that means we sit a block away before we pull up and we have to put on the mask, and we got to put on gloves, and we got to put on goggles, depending upon the totality of the circumstance. We've even changed our stance to where anytime one of our Swansea police officers gets out of the car and is going to come across the public anywhere, they have to have a mask on. And we think about this with law enforcement. You think about how many officers are out there and they come back to the station and they're typing reports or they're in their car and all these types of things. There's a high probability that we can infect another officer, an entire shift. And then what happens if half of the police department goes down? So we're being very, very cautious with that.
So how's the public reacted? Have they been generally helpful? And are there ways that you could recommend that if someone does need assistance from the police, should they come outside and meet you? Does that make your life easier if you don't have to go in a dwelling? Those type of things?
Chairman, that's a great question, and you're exactly right. Every single person that calls us, we're asking them to meet us outside. Fresh air, a little bit spaced out, that would help significantly. What we're also doing, and I was never a huge advocate for this, because I like for our officers to talk to people in person. They pay taxes. When they call the police, they want to see a police officer. But now we're taking a little bit different stance. If it's a non-violent, no suspect type of thing, like a mailbox smashed, that is very frustrating, but you want to report, we'll do a lot of those things over the phone. Sometimes we're even taking statements over the phone because I don't want to risk getting these officers infected because other people don't even know if they're carrying the virus yet. So I think if you call us, wait for us outside, or we're going to knock on the door and ask for you to come out. But I will say this, I think at least what I've seen, and I'm in close communication with many chiefs in the area almost daily, along with St. Clair County EMA and St. Clair County Sheriff's Department. And most people, what I see, are listening to this, are doing a very good job. Even if you go to Swansea Schnooks, there's a lot of people wearing masks. They're spaced out. I think most people are doing pretty good with this stuff. You just have that small percentage of the bad guys that still commit crimes, and they're not wearing a mask unless it's to conceal their identity. So
you, Chief, have one of the only testing sites, remote testing site in the county. What has that done for your call load? Do you have traffic concerns? Are there issues that you've had to deal with by having a testing site in your town?
So when I first heard that one was going to open up, it raised our anxiety level a little bit. What are we going to do with traffic on 159? How are people going to find the right place? What's going to happen there? Are we going to be inundated? And it literally has been no problem at all. I at one point I had the numbers, but they had tested several people, but the numbers were still extremely low. We've had no traffic concerns whatsoever. We have mutual aid agreements with neighboring departments in Illinois State Police that if we need additional help for traffic control, they would help, but we haven't had to call anybody. We've been doing pretty good.
How about in your parks? Your parks are open?
Our parks are open, and I got to throw this out there. We have some amazing parks in Swansea.
You do.
When it comes to the trails, the bike trails, the walking trails, they're just absolutely awesome. We left them open on a decision that people need to get out of their house and exercise, as long as they do it smart. Stay at a distance, those types of things. We tried at the beginning to leave some tennis courts and hockey and basketball open, but kids will be kids, and they're good people, but yet they got too close, so we've shut that down. And part of it was I really didn't want law enforcement officers to have to go up to a bunch of kids playing basketball and saying, hey, don't do that. It's not really what we're trying to do in modern day law enforcement. So we're preempting the problem by closing a lot of those things down. But you can still walk, you can play, you can run, you can do all those types of things. We've seen a significant increase on people using that. I love the fact I walk outside in my neighborhood and people I've never seen before are walking by and they're my neighbors. So
Well, there are some positives to this virus, although you got to look for them.
Yes.
With a microscope.
very closely.
How are your officers holding up to the stress? This is added stress at home, not only at home, but at work and everywhere else. Are they holding up pretty well?
I think law enforcement officers like firefighters and EMS, they all have this mask that they have on the front and nothing ever bothers them on the front. But like when you were talking about mental health, the reality is they're humans also. And I can guarantee you I don't have one law enforcement officer that doesn't have a family member at home that is bothered that they're coming to work. Because what are they bringing home? What are they, without even knowing it, who are they coming in contact with? We still have people that resist arrest, all those types of things. I think overall, law enforcement officers are very resilient and they're doing a great job, but we can't forget about them and we can't forget about how important that mental health aspect of it is. I'll just tell you, we do have an officer that's infected with COVID-19. He's doing very well. He's quarantined at home, hoping to come back relatively soon. We're fairly confident he was on a disturbance call and a person there was living at a residence that had it. Didn't know that at the time. So that adds a stress level for the whole department. And I'm cautious saying this, Chairman, but I'm going to say it. Like police officers, we never say burglaries went down because we do a great job. Because the next day they go up and then you say, well, Steve, you did a horrible job. What happened? But I think our department and most departments are doing a pretty good job protecting the officers, because an example of that is we had the one officer and no one else at our department got it. So even in our lunchroom, even when we're writing reports, squad cars, we're taking all the precautions we can.
You're doing a great job. And in all our departments, we're really proud in St. Clair County that we've been able to handle something that nobody ever anticipated. It may be, except for our the next person coming on might have anticipated a pandemic, but as far as that goes, I certainly didn't, and I don't even think Herb Simmons did. No. And Herb has a crystal ball.
Chief, thanks for coming in, and I personally want to thank you for participating in those weekly calls that we've been doing with the chiefs. I think that's really been beneficial. One thing you talked about, the difference in procedures. When you get that call, you have to stop down at the end of the street now and put your mask on and your gloves. But there are a lot of those times that you don't have that split second to do that. So I think that's something important, that it's that your officers, a pursuit maybe. They're chasing somebody. They don't have time to put that mask on. So the main thing is, if everybody stays home, of course, the bad guys aren't going to do that. But there are some of our good citizens that still haven't got that message yet. So what would your message be to the residents of Swansea and around the county?
I think when you look at me right here, I don't even take my mask off anymore. Why keep hitting your ears and everything else? I leave it on the entire time so that when I'm out there, people see that we have it on also. And I think it's very, very important. And I know there's some people that say, oh, this isn't as bad as some people make it out. I hope it's not as bad as we're all saying. But when you look at the numbers that you read at the beginning, this is out there. And why not err on the side of safety and do as much as you can? Wear the mask, social distance, go out when you have to go out, especially if you're labeled as essential with the job that you do, but be smart about those types of things. I think about this my entire life. I think I learned from my mom. We never grab a cart in a supermarket without wiping the handles down ever. And now we're not even thinking about it. When we first came in here and I saw you guys and hadn't seen you guys in a while, we all wanted to shake hands at the beginning, and then we held off. It's just rethinking the way that we do everything. I think the new virtual elbow rub will be the new thing that happens, and we've just all got to get used to that going forward.
Okay, well, we appreciate you coming in, taking the time. I know you're busy, but it really, I think, gets the word out there to the citizens in St. Clair County, especially in Swansea. So
Thanks,
you very
Director.
much.
Thank you.
Thank you, Chairman.
Chief,
Appreciate
be
it.
safe.
All right, thank you.
Thank you. So we all see the daily briefings from the President of the United States, from the governor. In the President's briefings, we hear from a representative from FEMA, and FEMA is a large agency that handles our emergencies. When it comes to the state level, we get to IEMA, which is the Illinois Emergency Management Agency, and we are in Region 8 of IEMA, and today we have the coordinator from Region 8 here, Doug Downey. Doug, welcome.
Thank you, Chairman, for having me. Appreciate it.
So, Doug, tell me a little about your role, IEMA's role in this COVID-19 pandemic.
Sure. First, I am the regional coordinator for Region 8, which consists of 11 counties and 2 municipalities that are accredited. And what our role is, basically, we are there, and they always say, an event or disaster always starts local and ends local. So our job is to be there as an asset or a resource to the counties, in this case, St. Clair County, that if there is a issue or a problem, an asset that they need assistance with, that they don't have that asset, they don't have that resource, or they don't have that information, they can reach out to the state then at my level and then get that information or that asset or that resource to help them with whatever the event or problem or situation or disaster is that is occurring within the county. So that's my job, is to be that there as assistance, and to coordinate all state efforts, state resources or state assets for the county.
So normally, when you're here and when we see you, we've got flooding issues. That seems to be the major disaster that we've always had in St. Clair County, Mississippi River, Kaskaskia River, and you're always here to help. Is this different?
This is totally different. Obviously, I've been with IEMA and state government for 15 years now with IEMA, and then additional 5 years with another agency. But our disasters have always been tornadoes and floods. That's kind of our bread and butter, and that's what we respond to the most. And especially the last couple of years have been flooding. And then for flooding, pretty much we know from past experience and past events what resources or assets are going to be needed by the county, because we have that information on file with us. But for this event, this pandemic is very new for the state. Although we've exercised it in the past, we've had state exercises, we have state plans in place. But you never know what type of pandemic it is, what kind of resources are going to be needed, how the counties are going to respond and react to it, what resources they might need, and how it's going to affect the citizens of the county. So this is a totally everybody at the state level is kind of learning from this, as well as I'm sure at the county level is learning from this, and so that as in the future, if if we have another pandemic, another event, hopefully we can take that information and use that so we don't stumble through the same problems, the same issues the next go around. Hopefully there isn't one, but if it is, we will be better prepared.
We always learn. So, personal protective equipment, PPE, that's a term that we've all come to know during this pandemic. Explain to us. So you have a state stockpile, which initially was sent out to the local regions, and then the federal government sends things to the state, and you distribute them. Let's talk about that process a little bit. And what are those items? Is it just PPEs, or is it something, or is there other equipment that people are requesting that's larger that they'll have to return to you when this is all over?
Sure. So again, at the state level, we did maintain a stockpile of various items, and one of those items is the PPE, the mask, the gowns, the gloves, the goggles, face shields, and other PPE items. But along with that, we had some medication that we kept, different forms of medication that we kept on file for different viruses or different pandemics. And at the same level, the federal government, FEMA, also has a strategic national stockpile, and they kept the same items. They have medications that they keep certain stockpiles of, PPE, and other assets that they would maintain a stockpile of. And so we, when this event happened, we started releasing some of these items to the counties and to the public health and to the hospitals and first responders. And then as we started depleting our assets and our resources, we called upon FEMA and the feds to also do the same. As we were running low, we asked them for additional assets and resources. And then at the same time, we have a whole committee of folks that were involved in procurement. So whatever items that were needed most by the county, or that we anticipated were going to be needed most by the county, we started looking for vendors, companies that could provide them to us. But also at the same time, so was it every other state in the country, as well as a lot of other countries looking for those items and those assets. So the first couple of weeks of this event, it was very, very difficult to get any supply or any stock. So I know as local EMAs and first responders were depleting their inventory, they were starting to ring the bell, hey, we're running low, we need something. And then we were doing the same thing on our level, trying to find those vendors and those companies to supply us with those requested items.
So let's talk a little bit about if we're reaching the peak and we start to envision light at the end of the tunnel. All the expenses that are put out by different corporate authorities, they're keeping track of. Will those numbers then be submitted to you for federal reimbursement for those dollars, since the state has a disaster declaration, as does every other state in the union? Is that the way that's going to work?
And you're correct, Chairman. So the governor has issued a disaster declaration for every county, all 102 counties for the state of Illinois. And so and then we put in a request for reimbursement to the President of the United States, and he automatically approved that request. So for any jurisdiction in the state of Illinois, and we've been through this with the flooding, with the same process, but the same process occurs here, is that the federal government and the state will cover 75% of all costs initiated by the county or the jurisdiction, and then the county or jurisdiction will then be responsible for the other 25%. So we are just now starting to get into the which is called the public assistance process, is we've asked the county to track their cost, and also jurisdictions within the county to track their cost. And eventually here within probably the next couple of weeks, we're going to start looking towards the counties to give us that information so that we can start input into our database and see how much expense that has been incurred by all jurisdictions, so we can start asking the federal government for that reimbursement. So I know the initial deadline for those requests were April the 12th, but they've extended that under the 30 days so that all jurisdictions have the opportunity to put that initial request in. And it's just simply a one-page document that says, hey, I have expenses related to this event, and I'm going to be seeking reimbursement.
And just so the public is clear, these are approved costs. They have to be COVID-19 related. And I think there is a date that they'll look at your actual yearly budget to make sure that these things aren't normal costs that you had budgeted. These are extraordinary expenses that are due to the fact that COVID-19 came about, and your municipality or your governmental entity decided to spend this money to try to alleviate those problems.
You're correct, and there's a very extensive list, and I could spend hours relating it to you. But the counties are aware of what is eligible to be reimbursed And then we made sure to try to get that information out to all the jurisdictions too, so they know, what they need, information they need to be tracking as far as anything was purchased, any overtime that was occurred by the county, or any other jurisdiction that was involved in this response or recovery effort.
Great. All right, Doug, I appreciate you being here. Herb, I'm sure you've got something.
Always got something for Doug. I mean, we've been joined at the hips, not only through this, but many other the flooding and the tornadoes and stuff like that. So Doug is a good friend of St. Clair County. A little bit, Doug, you talked about the stockpile
Yes.
that the state has. One of the questions that we get and some of the viewers comment on, they've heard so much about the PPEs, the lack of, and I think over the past type of disasters that we've had, those have been isolated. So those resources have always come pretty quickly.
Yes.
But now, is it fair to say that this statewide here in Illinois, that's one of the reasons why there was much more of a demand, and that's why there's been a lack of it?
You're correct, Herb. You are correct. So with the flood, obviously, those are isolated events. They only affect certain areas of the state. So we're able to pull resources pretty quickly from the unaffected parts of the state. Or other states that may not be affected. So if we do any EMAC request for assets or personnel, those come pretty quickly, as Herb mentioned. But with this affecting, this is a statewide, in fact, a countrywide event. Any resources request on the behalf of the counties or jurisdictions. Also, other states are asking for those same requests, those same assets. So it has taken some time to try to get the supply chain to catch up with all of the demand for PPE, for first responders, and the counties that are requesting them.
Well, and that's good. I just wanted to get that out there. The other thing is that from time to time, communities will want to know why they just can't pick up the phone and call Springfield and, hey, I need this, I need a pallet of this. Can you explain to our viewers the process of why it has to go up the food chain, basically?
So we have a process in place so that if a jurisdiction has any request for any assets or any product, it should always go through the local level first, or the county level, which in this case would be St. Clair County. So in any request that any city or municipality in St. Clair County would have, it has to go through the St. Clair County EMA so that they can obtain the correct information that we would need, and then they would then in turn put that into either WebEOC or call me directly and say, hey, this is something we may need for one of our jurisdictions. So there is a process we have in place, and we'd like to stick with that for accountability and for continuity.
Well, Doug, I really appreciate all the work you do. Like I said, not only do we put it in WebEOC, we call you also
Yes,
because
yes.
we always give you that follow-up call to give you ahead of
And I
time.
appreciate that.
But no, we appreciate all your help here in St. Clair County, and I'm sure we'll be talking a lot more about this as the days come forward. Thank you.
Thank you, sir.
Appreciate it.
Thank you, Chairman.
Thank
Very
you.
much.
More good information today. Chief Johnson from Swansea, Doug Downey from IEMA. A little bit on the EMA side. Again, 8 o'clock conference call this morning. A lot of good information was exchanged back and forth. Today we had the mayor's call and the chief's calls, but both police and fire chiefs had our state's attorney Jim Gomrich sit in on them along with Chairman Kern, answered some of the questions from the chiefs, and we've been doing that each week now, and I think that's really been beneficial to our communities. Took another small delivery of some PPEs, some small amount of gloves came in, and some hand sanitizer. Already started handing them out this afternoon. In fact, we've delivered, or they picked up 16 different agencies have been here today to get that. We'll be doing a conference call here shortly with the governor's office that we do twice a week. And I want to give a special shout out to a couple of people. A young lady, Sandra Moore, got on the page last night and volunteered to make some masks, and she is able to follow us through the service interpreter we have here, Tammy. I want to give Sandra a shout out. She really enjoys the briefing. And then also about 2 o'clock this morning while I was wrapping things up, got a nice email from Jake from Marissa, who just had a lot of good things to say about these briefings and how it basically helps them feel a lot more comfortable of knowing what's going on here locally. So, I can't say it enough. You've heard everything here from, like I said, the chief and the zip codes.
I forgot to do the zip codes, Herb.
Oh, you got to do zip codes.
Yeah, so you'll
Okay.
have to save your,
You got to do zip codes. We got to do zip codes, or otherwise I'll be up till 4 o'clock in the morning answering all your questions.
okay, so, and then Herb's gonna wrap up with his herbism of the day. But the zip code reports today, 62201, we have 8, that's an increase of 1. 62203, we have 8, that is an increase of 1. 62204, we have 7, that is an increase of 1. 62206, we have 17, and that is an increase of 1. 62207, we have 14, that is an increase of 5. 62208, we have 18, that is an increase of 3. 62220, we have 11, that is an increase of 1. 62221, we have 22, that is an increase of 1. 62223, we have 18, that is an increase of 3. 62226, we have 32, that is an increase of 2. 62258, we have 9, that number remains the same. And 62269, we have 20, that is an increase of 2. And once again, these numbers come from the Illinois Department of Public Health, and that is their listing according to zip code. Herb?
Thank you. And just as we close out here today, before our young ladies come in and interpret this into our Spanish communities, you heard again today the numbers that Sam reported, more positive, and yes, another death. And we hope the day is coming real soon that those numbers will be 0 on both ends. You've heard it all. I mean, we tell you each and every day, if you haven't realized that this is for real. And for those of you who continue to come on and talk about you've heard this, you've saw this, you've had some doctor who is selling videos and selling something that they want you to drink, that's okay. You have a right to do that. We're telling you what the hard fact numbers are. And as I say every day, you can continue to be a part of the problem, or you can help be a part of that solution, and you can stay home and stay alive. We'll see you back here tomorrow afternoon at 3:30 for the next briefing. Thank you.